Welcome to this Fireside Chat, middle of the day, on a, I think, very interesting topic on access to healthcare by actually showing an example of how this access to healthcare can be put into practice. And I'm very happy to welcome Mrs. Wilsdorf from Germany, Hamburg, Alsterdorf, who is representing a already long-lasting model with different approaches in healthcare for people with multiple and cognitive disabilities. So, and already store your questions, because that is also one of the parts of the fireside chats that we have some discussion. Please, Mrs. Wilsdorf, would you introduce the projects?
Yes, thank you very much. My name is Sandra Wilsdorf. I'm from Hamburg, from the Protestant Foundation Alsterdorf. Alsterdorf is a part of Hamburg where the headquarter of the foundation is. And we have lots of different services for people with disabilities, and including housing, we have schools, we have living, and we have a long tradition. We have about more than 7,000 employees working for and with people with disabilities. So it's a long history, and I'm from the initiative Health for All Now, because we think that health is a very important issue. It's kind of the base to make their own decisions. It's really important. So we have various projects caring for health on the one hand, and on the other hand, the initiative tries to point out that there are many barriers in the healthcare system. And we try to remove these barriers by making the regular healthcare system more inclusive. We have various projects for that. And also we offer special services that are inclusive. So, to say?
Could you start by actually, in a perhaps quite comprehensive way, showing how these services developed over time and how you're covering both sides, access in a broad sense and specialized care and empowerment, because this is quite unique in your project to have that whole range developed over years. So let us quickly be your followers.
All right, so one of the biggest and most important projects is that we have an institute that cares for people with severe and multiple disabilities, and that had a 10th birthday this summer, and that has been developed out of the thought that we had good medical care for children with severe and multiple disabilities. We have a certain center for that, but when those people became 18, they would be sent to the regular system, thinking, well, there are enough doctors, there are hospitals, so just get your care there. And then we realized more and more that reality is different. And then we had long discussions that took a couple of years to persuade politicians and also to persuade other people that it needs this extra solution, because it's an extra solution, is not inclusion. But finally, everybody concluded that saying, yes, inclusion isn't reality yet. So we need this special institute, and that has been growing over the years. And now we have about 5,000 patients coming from all over Germany, getting medical care there in different fields, for example, neurology, orthopedics. And we newly opened also gynecological consultants and dental consultants, always following the needs, always finding out, well, there's another field where there is no care without barriers, even in a city like Hamburg, which is a second largest city in Germany. So following the need that has become bigger and bigger. And so that's one important part.
I think just to highlight that, in Germany, there is a real law which requires the local governments to establish centers for healthcare for people with multiple and complex disabilities. And yours is one of the first one which was established. And that is quite unique because there are few countries who have a law which is a framework to establish that. And I think up to now we have about 50 to 60 centers like that. And yours is one of the first. And I think what is very important also to discuss a little bit your outreach program. Because it's nice to have a center, people can come in, but when we studied your project, it was clear that it's much more than just a clinic where people can come to. Because, in fact, if people are in a bad condition, we have to approach them.
Yeah, that's one part. And the other thing is also that we always think it's good to have all those projects in Alsterdorf where people come, but we need to improve the whole surrounding, the whole world, if you want so. So we also have lots of projects where we try to remove barriers in the system around us. And for example, we launched a project which is called Health 25, according to the UN Declaration, where we have 2 model districts, people working there, bringing together all the important people for the healthcare system, hospitals, doctors, people with disabilities, trying to find out where they can improve the medical care in that certain area. For example, they have inclusive consultations where people with disabilities can come or Zoom or call to just say where they have difficulties. For example, when did they had an examination at a doctor's office and didn't understand the diagnosis. So it would be explained there. And we also installed empowerment workshops because people with disabilities said they have really difficulties going into hospitals. Many of them are afraid and they wouldn't go there. And they are afraid to go to a doctor because the whole system is based upon efficiency. There's just no time to get good explanations, and there are a lot of barriers apart from the physical barriers.
How do you approach the huge topic of case management? You know, a person known having a disability, how does that person know about your service and how do you get that person prepared to be supported?
We do have an extra project because we have we have a hospital and we found that many disabled persons are afraid to go into the hospital, and some of them wouldn't get a treatment although they suffer from terrible pain maybe for years, and they just don't take part in the regular health system and don't take their rights. So we figured out a project. We have installed so-called inclusion guides or inclusion pilots. We installed them in 2020, and we started up with 2 health insurances who would support that project. In the meantime, there are many more because it's so obvious that it's a good project, because these inclusion guides or pilots get information when a patient is expected in the hospital where it could be a certain necessity of communication. Maybe this person cannot express easily how he feels, he or she feels pain, or how to communicate. And sometimes people avoid, because of that, the stay in the hospital. So these inclusion pilots can be contacted in advance, and then they would come and visit the person before at their homes, trying to figure out what this person needs to feel secure, to feel safer in the hospital. And then this pilot would take this information into the hospital to the doctors and the medical care team, so they are prepared. And then the person comes into the hospital, they would meet this pilot again, so there's a familiar person that makes it easier as well. And in the end, they would also give information at the homes or wherever the person lives. And this is so successful that we can show year after year that we reduce this, how do you call this revolving door effect.
Yeah.
And this is reduced tremendously because the treatment is so much more efficient because the doctors and the care team know what this person suffers from, and also it's easier to communicate.
How is this exclusion guide be trained, and what is the profession they have, and where are they allocated in the hospital system?
Yes, they are all medical experts. Some of them were before nurses, for example, and then they had a special extra training, and they are employed by our hospital, and their services are paid by these health insurances.
And the people in the communities and the stakeholders of facilities for people with disabilities know about them.
Yes, yeah. Yeah, we try to constantly inform everybody about the existence of these inclusion guides. We only have them in our hospital, and our hospital is not that kind of emergency hospital.
Okay.
So they only have planned stays, so they know in advance who's going to come.
Is this model of an inclusion guide also being done in other places already?
No, not yet. But we wish to be a model, to be an inspiration, because this is something that is actually not that expensive, but it's so efficient and so good. Because we've many patients coming to the hospital for the first time in their lives, or for years or centuries, and sometimes suffering can be improved easily. You just need to know.
I think that's a very important point to make, to have this bridge, a human bridge, with all that. No, you can't solve the problem of fear and stress, and if you have that visit at home first, it is like a bridge you can walk over. And I think this project deserves to be really studied in detail and also spread over other places. Although we are really happy that we have the special units and we have health education, but this guide on your side is one of the most important things to make everything function, and even to go on after the treatment process and to keep that relationship to some extent. So the health insurance is paying that as a project.
Yes, in that case, yes. It's limited until 2028 now, and we are really hoping that it's going to be prolonged, and then it's going to be normality one day. This is the case for many projects we're doing. They are really proving that it improves people's lives. And yeah, it's really hard to find funding. And but in the end, we hope that many of these ideas are just becoming reality.
Is there any research on that project?
Yes, we have to, each year we have to, count the patients and measure, and then, tell it to the health insurance they want to know, yes. There's also this other project about health promotion.
Yeah, a few words about that.
Yes. We also have a big project about health promotion, thinking that health promotion is good for everybody, of course, we know all that. And but people with disabilities don't take their rights there as well, because there are no offers or they don't know about it, whatever. And we've installed this project where health experts also go home to people who take part in the project. It's also on a very individual basis, trying to find out how and in which fields wants this person to improve their life in health, under health aspects. Many of them say, well, I would eat more healthy. I would like to do sports, but I don't know how and I don't know where. And then they would find together a way over a year what kind of offers are in the surrounding these people live. And then they would maybe, try to, get this person doing or taking part, trying things out. And we have done that before for 3 years. It was a limited funding. And it was tremendous how life changed. It was really impressive. And now we're really happy that we can continue that project a little different, but with the same principle. Accompanying people by making their lives better.
Thank you so much so far. Other questions? No questions, I was told. No time, but I think you will stay here, over there or there, that people could approach you and ask questions directly.
Yes, I would be happy. Thank you.
Thank you so much for spending your interest with us. Thank you.